As of today, more than 10,000 Americans from every state but Wyoming have tested positive.
The CDC says there have been 10 cases in Kentucky so far. Kentucky Department for Public Health Commissioner Dr. Stephen Stacks says at the rate it's going now, it'll likely become a pandemic.
In-depth reporter Christiana Ford talked to him today about the fight against monkeypox and the stigma surrounding it.
Twice a week, Josh Porter laces up his sneakers and goes for a walk.
I was just kind of running and walking on my own during the pandemic.
Then he found Front Runners Lexington, an inclusive group of queer runners and walkers.
How was the walk?
Because they enjoy each other's company just as much as they enjoy staying active, they've become friends.
On Wednesdays, we go eat dinner together. Saturdays, we get coffee together.
As monkeypox cases increase in Kentucky and across the country, it's been top of mind for him as a gay man.
I wouldn't say I'm scared and freaked out, but I'm definitely worried of just the way that we know it's gonna keep spreading.
Worried about how to keep himself and the people he cares about safe. The stigma against the queer community is making it even tougher.
It definitely makes it complicated to talk about where, you want to fight the idea that this is a gay sex disease, because it's really not.
There have been a lot of criticism about how the U.S. is handling monkeypox, from the messaging and influx of misinformation to the absence of data and low supply of monkeypox vaccines.
All the people I know want to help and want to be safe and want to get vaccinated, but just not really likely right now. It's not easy to do. Not the vaccine route that I was hoping for, to say the least.
Kentucky's top doctor, Stephen Stacks, says he really does understand that frustration.
We share the frustration. Part of the big challenge is there's only so much to go around.
Dr. Stacks says Kentucky's first allocation was only 296 doses, so they could only treat 150 people. More shipments have come and they're now up to 3,700 doses. But he says the need for more is urgent.
It feels more like calling the radio station to win a prize than actually calling to schedule for something you need. So we are working as aggressively as we can with the supply we have, and we will in the weeks ahead do our very best to try to make it more clear and available to folks. But right now, there just simply is not enough supply to make it available to all the persons who would like to receive it.
In the meantime, organizations who work to fight HIV and AIDS stigma like AVOL are now working to help with the messaging around monkeypox.
We've been fighting stigma every day for the last 30 years, so this is nothing new to us.
It's a delicate balance. As of August 10th, nearly 10,400 cases of monkeypox had been confirmed in the United States, and it is a public health emergency. AVOL says that's why focusing on outreach that is appropriate but not harmful is key.
Cases we've seen so far in the United States have been among gay populations, but we're here to say that the monkeypox virus is like any other virus. Anybody can get it.
The facts are, no one in the United States has died from monkeypox so far. Monkeypox can be transmitted through skin-to-skin contact or close physical contact, and that doesn't have to be sexual. Dr. Stacks says that's why it's important to not punish gay and bisexual men just because of disproportionate impact right now.
COVID has shown very clearly, even though it spreads very differently, that we're all in this together, and we're not all safe until each of us and every one of us is safe.
Porter says recognizing that is an important first step. Christiana Ford, Evening Edition.
The Lexington Health Department is holding a monkeypox vaccine clinic on August 18th from 9 a.m. to 5 p.m.
It's free, but you do have to register in advance because, as we said, that supply is limited. You can register at lfchd.org/monkeypox.